Next on Primary Care, do you know Black women are at higher risk for many health issues and that regular routine screenings can help reduce their risk?
It's important for everyone to start with getting a regular physical exam, and that's across every decade, so that you have a relationship with a physician that will help you to determine what things really need to be done.
Hello, I'm Dr. Lonnie Joe, and welcome to Primary Care, the show dedicated to improving the health of African Americans. Regular checkups and screenings play a crucial role in safeguarding the health and well-being of Black women. They enable early detection and intervention for conditions that disproportionately impact them and are essential to preventing and managing diseases. Regular screening not only saves lives, but they also serve as a means to address many of the health disparities and systemic racism that persists for Black women. Today, we're pleased to have with us Dr. Earlexia Norwood to discuss the significance of regular checkups and screenings for improving the health of Black women. Dr. Norwood is a board-certified family medicine physician with over 35 years of healthcare experience. 29 of those years were with the Henry Ford Health System. Today, she is the founder and CEO of Walk in Wholeness. Dr. Norwood, it's great to see you, and welcome to the show.
Thank you, Dr. Joe. A pleasure to be with you today.
Great. You know, it is always amazing that some of us are getting older and some of us don't change. They stay the same.
I know. Well, at the young age of 22, I'm still trying to figure out how I'm going to move forward.
What the secret is,
yes.
Right? Very good.
Yes, sir.
What screenings, when we talk about screenings, are so essential to prevention of diseases. Yes. What screenings should people participate in, and why don't we approach that from a age category? What screening should we be looking at for young women in their 20s?
Okay. Well, you're right. The screenings vary based upon the decades, on both age and as well as other risk factors. So, for instance, for me, starting with the 20s, it's important for everyone to start with getting a regular physical exam, and that's across every decade, so that you have a relationship with a physician that will help you to determine what things really need to be done. So in the 20s, you think you have no health risk, right? You're young, you're healthy, and maybe in college, but there are health risks that occur even in the 20-year-olds. So it's important that you start to develop good habits in your 20s. The way you exercise, the way you move, the way you eat, the things you eat and drink. You know, we talk about with college freshmen that freshmen 15 and 20 pounds that they put on. Well, that's because of having poor habits, drinking a lot of caffeine and not getting enough water. Staying up late, not getting enough sleep. Right. So those type of habits you want to start to put in place in your 20s. Then you think about immunizations for those for 20-year-olds. You want the 20 college students to make sure that they have their meningitis vaccines. There's the HPV vaccine. Yes. The HPV vaccine is actually recommended as early as age 9, right. And then 11 and 12 year olds to get it as well. But if you're getting it after the age of 15, which you can still getting at least 3 of those vaccines after the age of 15 for HPV is so crucial, because 85% of people in this country will be infected with the HPV infection in their lifetime.
Yeah, and you know, and I know you're aware of the discussions that we've had at the National Medical Association level.
Yes.
15, 20 years ago, this is not a new vaccine, but
no, it's not.
From the pharmaceutical approach, it was not directed properly in terms of who should get it. And it was made to appear that this was a minority disease, when in actuality, this kind of service raised all boats, and we had to address that.
Yes, we did, because this infection isn't race-based.
Yeah, absolutely.
It's not race-based, and I don't like either how it's also been categorized more so around being promiscuous. It's not about that. This is the only vaccine that I'm aware of, and you help me, Dr. Joe, the only vaccine that I'm aware of that actually decreases your risk of a cancer.
Absolutely.
You know,
I don't know of any.
I don't know of any other vaccine that reduces your risk of cancer, reducing the risk of cervical cancer, oral cancer, rectal cancers.
Right.
So My kids, and I have a son and a daughter, and both of them have gotten the vaccine.
Mm-hmm.
And if, at 22, I should get it too, huh?
Absolutely. Do you, this might be a little bit off the beaten path here, so to
Yes.
speak, but do you see a role for genetic testing early on in life, in the 20s?
I don't, unless there's significant risk factors based upon a family history of breast cancer that may be starting where women have the aggressive cancer in their 30s, or even some of the colon and rectal cancers that occur early on. Then you really want to think about genetic testing or concerns 10 years prior to that family member being diagnosed as being a part of the risk factors.
And hopefully we never have to face this, but the statistics tell us the story, and as people get through life, it's busy, we're inundated with all kinds of things, we're seeing more need for counseling and psychiatric services in the 30s now, in young adults.
Yes. Yes. So the 30s, the magnificent 30s is, and let me say this too, Dr. Joe, with the 20s too, most people don't think of it, but young women need to have pap smears done.
Yes.
And those pap smears should start at age 21, not when they're sexually active. And before, the thought was you start those pap smears whenever you become sexually active. So if you're sexually active at the age of 18 or 17 to do the pap smears, you should not do the pap smear before age 21. And the reason is that the HPV virus is prevalent, and very often some of those viruses may give you an abnormal pap smear that will not be consequential at all. So you don't want to be picking up things that that have no consequence and can actually cause young women to have incompetent cervixes as they get older. So pap smears starting at age 21, 21 to 29, getting a pap smear every 3 years consistently, and then in the 30s, as we're talking about, the pap smear should be done every 3 years or every 5 years if you're doing it with the HPV testing.
Okay. So now we're moving along. We've had a few birthdays. Now we hit that magic number of 40s for women.
Yes.
What are we dealing with in terms of screening?
Yeah, so in 40s, you think of the cancer risk and the chronic disease risk. So the risk of hypertension, diabetes, those occur more. So you want to make sure that you're getting those testings done. And mammogram testing for women is really crucial. So there are two different schools of recommendation. So the American College of Obstetrics and Gynecology, they recommend starting getting your mammograms at age 40. And for the the United States Preventive Services Task Force, the recommendation is to start at 50. So most women, I actually start recommending those mammograms in their 40s, and then they should get it every 1 to 2 years based upon risk.
American College of Radiology, with their statistics, say start at 40 and don't buy into the task force recommendation or the hint that every 2 years for a mammogram, get the mammogram every year.
Yes, and and a big reason for that, especially for women of color, is we know that Black women have a higher risk of the triple negative breast cancers, which are harder to treat. So we want to find these cancers early so that we can manage them more efficiently.
Right. Early detection in triple negative, as you know, is invaluable because it's so responsive to treatment. If we can detect it earlier, as the clock ticks and it gets behind us, I mean, we lose those patients at an astonishing young age if we're not careful about that. But here again, that brings into mind colorectal cancer for women in their 40s.
Absolutely. So the old recommendations were that you do your colonoscopy starting at age 50 when you have no risk. I'm so grateful we've moved that to 45. What's the actor's name?
From Black Panther.
Black Panther.
Yes, Boswick. Yes.
Boswick.
Yes.
Who died of colon cancer, and he had symptoms, very young. So we are now recommending colon cancer screening starting at age 45, and then doing the colon cancer screening every based upon the testing, the type of test that you do, whether it's the colonoscopy every 10 years, if it's the sigmoidoscopy every 5 years, if you're doing the stool cards every year, if you're doing Cologuard every 3 years.
Right.
So, and then again, looking at the risk. If there's a family history of colon cancer, then you even, if your dad had colon cancer at age 40, then you don't wait until you're 40. You need to do it
Start
sooner.
early.
Yes,
That's
sir.
so important. People need to know that. Providers need to know that also. we're seeing too many gaps in this
Yes.
approach to colon cancer right now. I think we're making progress. It's just not quite fast enough in order for us to turn the tide in terms of detection, okay? You mentioned Cologuard. Cologuard has been invaluable because of patient acceptance in terms of doing this. Everybody was afraid of going to sleep for the colonoscopy and the drinking all of the solution and all of the prep that was associated with it. Touch on Cologuard a little bit and how it has changed the approach to treatment of this disease.
Yeah. So before Cologuard, you know, we would do the stools test
Right.
in our offices where we could do the digital
Right.
digital finger test
Right.
and even give patients those cards to take home.
home.
But those cards, unfortunately, interacted with a lot of different foods. So you could get a lot of false positives when there really wasn't any blood in the stool. So with Cologuard, it's DNA based and blood based, looking for possible abnormalities in the colon. So it's definitely a better way of testing without the patient having to be put asleep. They can do it at home, and those results are a lot more reliable too than the older tests that we've had to use in the past.
So the women in my family are now in their 40s, and we know that things change,
Yes, they do.
especially from a hormonal standpoint of view. What part does exercise play as women continue to progress age-wise?
So in your 40s, most women are getting into that perimenopausal time of life. And perimenopause means you're around the time of menopause. So menopause is when you don't have a period at all for a year. And the typical age for that is around 51 to 52. But women who are perimenopausal in their 40s can start to get some of those symptoms that make you feel like you're there, right? So they can start to have irregular periods, having hot flashes, having vaginal dryness, having mood swings. And Dr. Joe, one of the things I always like to tell women is don't think that everything is about being
menopause, yes.
menopausal
It's
or
not an
perimenopausal.
excuse, huh?
It is not an excuse.
Okay.
If you have lost your job, there is a reason for you to feel anxious. And it may not be menopause. And if you're in an abusive relationship, there's a reason for you to feel anxious and to have night sweats and heart palpitations that may have nothing to do with menopause, as well as other medical issues that can be a part of that problem too, from the thyroid and other issues. So everything isn't menopause, but if you're having perimenopausal symptoms with the hot flashes, vaginal dryness, even some changes in mentation where you feel, you know, you're not as sharp as you used to be mentally and cognitively connected, then there are some options and treatments that are available to help.
But, you know, my first cousin is still having these menopausal, perimenopausal symptoms.
Yes.
What can be done to treat the symptoms?
Oh, there's so many things that you can do for menopause, menopausal symptoms. One, I like the conservative treatment of dressing in layers, drinking lots of fluids, avoiding caffeine. There's some medicines that we have available too that can actually help with some of the symptoms of menopause. Some of them that are used for depression can help with menopause. And then there are some other medicines that are even used for high blood pressure that we found that can actually be beneficial for menopause, for women who are having symptoms with menopause. But estrogen is still a real option too. And very often women don't think that they can have estrogen because of some of the bad press that estrogen got. But we know that if we give estrogen for the short periods and for the lowest amount possible for a defined period for people who need it, that it can be very helpful too. And I also want women to know in their 50s or whenever they have a surgery like a hysterectomy, if you did not have a hysterectomy because of cervical cancer or some gynecological cancer, you don't need a pap smear every year. A pap smear is to detect cervical cancer. If you no longer have a cervix,
You don't need it.
you don't need a pap smear. And so I've had women who've been getting these pap smears, Dr. Joe, for years, and there's nothing there. They've had a complete hysterectomy, no ovaries, no uterus, no cervix, and they're getting pap smears done every year when there's no cervix, no risk of cervical cancer for them. So talk to your doctor because there are different types of hysterectomies that are done. Some are done that are above the cervix, some that are done remove the cervix. So talk to your doctor to know if you've had a hysterectomy or no longer need to have a pap smear done at all.
So we've hit 50 now, and mammograms are being addressed and
Absolutely.
being conducted. Any other tests? Is there a role for lung cancer screening in this age group also, especially in smokers?
Oh, very much so, Dr. Joe. So definitely women in their 50s should be getting their mammograms done regularly. That's across the board, every 1 to 2 years, getting the mammograms done, the pap smears done as well, again, every 3 to 5 years based upon risk. And HPV testing and the colon cancer screening still in their 50s as well, based upon the tests that they do. For lung cancer, the recommendation is that if you are a smoker, a current smoker, or have smoked and stopped smoking within the last 15 years, that you should have an annual low-dose CT scan done to look for risk of lung cancer. People who smoke a 20-pack year history, and that's always, how do you figure that out?
Right.
If you smoke 2 packs of cigarettes a day
For 10
and you've
years.
smoked for 10 years, that's a 20-year pack year history. So you'd need to have a lung scan done for lung cancer. And this is important because more people die from lung cancer, Dr. Joe, than they do any of the other cancers. Combined.
Right.
With prostate, breast. So we know that lung cancer is the #1 cancer in this country that kills people.
So, shingles vaccine.
Yes, sir.
You're 55 years old. Do you really need a shingles vaccine?
Yes, you do, Dr. Joe. Everyone 50 and over should have 2 shingles vaccines. And this is why. If you never had chickenpox, you have no risk of getting shingles, right? So now we're vaccinating kids younger for chickenpox in the hope that they won't ever get shingles because they've had the chickenpox vaccine. But for adults, before the chickenpox vaccine was made available, if you had chickenpox, those same nerve endings can become activated as adults and much older in life, and you can have the risk of getting shingles. So the shingles vaccine is recommended for 50 and up, and it's a series of 2 shots, 6 months apart.
Yeah, it's amazing how a substance, a virus like that, can lie dormant in the system, and the reoccurrence of it decades later can drive you crazy.
Yes, and the pain that you get from those nerve endings being reactivated is a very painful infection. So ideally, if we can prevent that for patients, we would like to with the vaccine.
So we've had a few more birthdays, celebrated a few more birthdays. We're in our 60s.
Yes.
We've up to date on our mammograms. We continue to get our pap smears. We're getting our vaccines. What about hearing and vision?
So hearing and vision are important to do as well, and especially for our diabetics. It's important to make sure that you continue to get your eye exams done every year. And for other reasons, such as the forming of cataracts and glaucoma, those are things that can be done as a part of the vision exam. And hearing is usually recommended whenever people say, I'm sorry, I can't, you're not hearing as well. That's typically the time when people go, well, maybe I really do need to get a hearing test done. So yes, so making sure that the hearing is done too. The task force doesn't have a global recommendation for asymptomatic patients around hearing. So it's really based upon risk factors and symptoms.
Bone loss.
Bone loss. Yes, sir.
We need to start thinking about that sooner instead of later.
Yes, we do.
Simply because of a lot of lifestyle changes that have occurred. When does bone densitometry figure into this picture for you?
Yeah, so usually we recommend getting a bone density test around age 65. Think of your entire life, even in your 20s, you are building up bone, building up bone, building up bone. And then usually around 30, 35, that's about the peak bone mass that you actually collect. So then you're actually losing bone. So you want to try to do what you can to keep it as steady as you can at peak bone mass, or not lose more than you're gaining.
But
right?
there is bone loss that is occurring before the recommended diagnostic test age.
Yes, there are. Yes, and because there's a constant turnover of bone, and so that's why the goal is to make sure that you are gaining, hopefully doing things to decrease the loss of bone. So for some people who have an increased risk of bone loss, which may be related to not having milk and calcium, which we know is very prevalent in the African American community, that there is a lactose intolerance, so they're not getting the calcium that they need to maintain that bone of 1,000 to 1,500 milligrams of calcium per day. I want to make those individuals aware that you can get calcium from other sources. Collard greens, turnips are high in calcium. Yogurt is high in calcium. There are even some calcium and vitamin D fortified orange juices that you can take instead of milk. So there are other ways of getting that calcium in, including a calcium supplement, so that you can help to maintain that bone mass. But making sure that if you're taking a calcium supplement, and I'm not a big proponent of pills, Dr. Joe, of taking all of these different pills and all of these different supplements. I want to get my supplements from my food, and that's what I encourage people to do. But if you're taking a calcium supplement, for instance, make sure that you're not taking more than 500, because if you take 1,000 milligram calcium pill, your gut is only able to absorb 500. So you're wasting your money buying these large mega dose pills when your gut, for instance, for calcium, is only absorbing 500. So it's important for us to maintain that bone mass as much as we can.
Touch on vitamin D for us. And the reason I ask is because for years we thought it was a vitamin. Now we know it's a hormone. What's the role of vitamin D? How is it affecting the menopausal phase for women?
Yeah, so vitamin D, I think, has so many different benefits. One, we know that it's a critical element to make sure that calcium is absorbed to help our bones. And we can get lots of vitamin D free from the sun, right? But the concern with getting it from the sun is, one, the risk of cancer, because there's an increased risk of skin cancer from vitamin D. From trying to get it from the sun. But so that's ideally not the first place to get it. And the United States Preventive Task Force has said that we shouldn't check vitamin D levels, that there is insufficient evidence to support doing regular vitamin D testing or screening across the board. So I think we need to be selective in how we do it. There are reasons, I think, for doing a vitamin D test, and you just need to be aware of, especially individuals who are at increased risk for bone loss, increased risk of malnutrition because of not getting the calcium and the vitamin D, multiple fractures. Then you want to try to determine what that is, and so that you can treat it appropriately. So the vitamin D is a key element, we think, in quite a few other things, even in the relationship to hormonal balance. And women with both having hot flashes, there may be some benefit there as well.
We touched on it a little bit earlier, but even after we've gone through the decades, this whole thing of mental health continues to haunt us, or begins to haunt us. How can you go through a lifetime of all these situations, stressors, and not have some form of outcome that says, boy, there's a little bit of mental distress here that needs to be addressed? Not to mention that in a lot of instances, it is not approached properly. You certainly don't want your patient to think that my doctor thinks that I'm crazy, okay? But there has to be a way that we break that barrier, break that ice to say, look, I think we need to focus on this area of your health.
I believe physical, spiritual, mental. We talk about the exercise, which is physical. If your spiritual life is off for me, I'm sick.
You're sick.
Messed up. I'm sick when my spiritual life is messed up, and when I am mentally not in the right space, there is a real problem, and that's the case with every patient that we see, because as you noted, every patient will come with their own areas of concern. So the recommendation, and I'm grateful, this has actually been changed by the task force, that they now recommend that we screen starting at age 8 for anxiety. Age 8 to 64, that we actually do the screening for individuals from 8 to 64, and for depression from 12 up to adults. So the recognition that this is a real illness and a real matter that affects people starting as young as age 8 and 12. We've seen the suicide rates that have occurred in not only teenagers but adults. The number one age group that has the highest risk for suicide is actually senior males, elderly white males. But we know in our community that suicide is very real because of all of the inherent issues that occur with not only their physical health, but the issues that occur economically in our communities. So we need to address it. That's why there is a recommendation that with every exam, every time a patient comes in the office, that we do those screening tests, two screening questions to simply screen for depression to see if it's there, and if it's there, to do more testing.
We're even getting physician report cards to say you did or you did not do it.
Yes.
We can't let the opportunity go past to have you comment on your latest project, your latest venture, which is Walk in Wholeness. Tell us about that. I know it's exciting.
Oh, yes. So I'm my partner, Dr. Gwen Grady Dansby. We're two physicians. Dr. Grady Dansby is a geriatrician by training, and I'm a family medicine physician by training. And our goal is to make sure that we come together to make sure that communities are whole around the full person, physical, mental, spiritual, and we want to make sure we get the news of how to make sure these mistruths around care are not prevalent in communities, businesses, so that people can walk in wholeness.
Isn't that wonderful? Well, we are unfortunately out of time, but let me just say this. This community has certainly benefited from your presence and your commitment and your service. We are just so proud to have you on the show today, and we'll have to do this again.
Please.
Okay, thank you so much.
Thank you.
Thank you. We've been talking with Dr. Earlexia Norwood, CEO of Walk in Wholeness. Prioritizing routine checkups and screening empower women to take care of their health. No more of this stuff that mom is strong and she's a strong black woman. We need to get beyond that. We can do better in terms of outcomes. The screenings help break down systemic barriers and pave way to improve health outcomes. For Primary Care, I'm Dr. Lonnie Joe.